Hi guys, it's Dr. Sonny. Thanks for joining us here at Satya Health. It's Mental Health Awareness Week, so we wanted to spread some awareness on what is really a public health epidemic. Tens of millions of people are suffering from mental health related illnesses, and there's been about a 60% increase in the number of pharmaceuticals that are dispensed in the past 10 years. So we really feel that the conventional approach here is quite limited. After practicing in it for so many years, we realize that depression is your whole body. Your whole body is being affected by it, and there are multiple areas that need to be addressed. And so we like to look at it more as a whole body approach. The first thing that we like to look at is really about how the brain is communicating with the rest of the body via hormones. What I'm talking about specifically here is how the brain communicates with the adrenal glands. So we've all heard of fight or flight. That is how the brain communicates with the adrenals in the short term, giving us a burst of adrenaline whenever we need it in the short term. But in the long term, the brain really tells the adrenal glands to secrete a hormone called cortisol. Now, cortisol has many wide-ranging effects throughout the body. It affects many other organs, including the thyroid gland, which we'll talk about in a future video because that's quite important. But what high cortisol means is that your body is under a large degree of stress over a long period of time. And we can measure this fairly accurately through just using saliva measurements throughout one day that show us the degree of stress that your body is under. Really, this is a hallmark of depression and anxiety. Now, you may know of some people who have actually benefited from antidepressant medication. The reason for this is actually that they have very high levels of cortisol that are being suppressed down into a normal range now by the antidepressant medication. This is a good thing in the short term, but in the long term, the adrenal glands will actually fatigue, and suppressing cortisol down that low can actually lead to worsening effects like fatigue and worsening depression. And then we see people increasing the dose of their medication thinking that that might be the answer, and it often just makes things worse. So we really like to take an integrative approach. We like to support the adrenal glands, decrease any inflammation, and also look at which neurotransmitters are imbalanced and support those. Now you might ask, how does inflammation play a role into this? Well, actually, the most recent psychiatric literature is showing that inflammation of the brain is one of the main causes of depression. So a brain can actually get inflamed, hot, red, swollen, and it's pretty amazing that this can lead to mood disorders that are so common. So we like to test for brain inflammation using an at-home urine test, which is called organic acids. It looks at markers of inflammation in the inflammatory response. In particular, kynurenate, quinolinate, and picolinate are these markers for brain inflammation, and we get to see them here on a very simple test. The other great thing about this test is we can see neurotransmitter markers for both serotonin and dopamine. Now, dopamine is the happy chemical. It makes us feel good, and a lot of times people run out of their dopamine and don't feel so good. So it's very important to balance. Something we need to realize as well is that serotonin and dopamine are actually made in a very similar pathway in the body and broken down by the exact same enzyme in the body. So we need a balance between these two. And that's another limitation of these pharmaceutical agents. They only look at serotonin, neglecting dopamine. And oftentimes people don't get their results because their dopamine is just not balanced. So we can very accurately measure both serotonin and dopamine here with 5-hydroxyindole acetate and homovanillate, the breakdown products of each neurotransmitter, and balance them out very accurately. So we can see now how looking at depression, anxiety, mental health in a holistic approach and using advanced testing can give us an insight into how the whole body is functioning, from the brain to the hormones to the adrenal glands to even the thyroid to the immune system when we talk about inflammation. This is a more holistic picture of what we need in order to really optimize our mental health. The next thing we would do is to create an individualized nutraceutical program that would balance your individual chemistry to give you the energy to really pursue the tools and techniques that are out there for long-term mental well-being. So hopefully you found this useful. Please keep spreading mental health awareness. Leave any questions or comments you have for us. And thank you so much for joining us at Satya Health.